everybody, and welcome to the next conversation with a doc. We're very lucky today to have Dr. Lisa Shulman with us. She's a movement disorder specialist at the University of Maryland, and she specializes in treating Parkinson's disease and other movement and memory disorders. So instead of, reading this very long introduction, these wonderful words, I'm going to just let Dr. Shulman take it away, and she's going to be talking about exercise and the importance. So welcome.
Okay, well, thank you, Judy. And it's a pleasure to be with all of you this evening and to talk about one of my favorite topics. I'm going to talk in kind of a general way about a number of topics, but I hope that you'll be thinking about your own questions because the discussion can be my favorite part. So, I've been treating Parkinson's disease and other movement and memory disorders for, I have to say, about 30 years now. When I've always been interested in exercise, and I've always been a big believer. I've just always had a lot of confidence that physical activity and exercise and cognitive activity, social activity, I've always believed that all of this was very important for health in general and for Parkinson's disease specifically. But in the early years, 25 to 30 years ago, I would actually talk about this at patient symposia, but all of my colleagues thought it was just kind of like really softball stuff. I was kind of like a little bit out there in the ether that I thought this was a important medical topic. At that time, there were actually very few studies of exercise, whereas today there's more and more studies of exercise and activity. And there was virtually none in Parkinson's disease at that time. And I remember going all those years back that what I used to talk about was animal data, because that's really all there was. And the animal data was very interesting at that time. There was a study that looked at, it's usually rats. You looked at rats, and you may have once heard of this. They separated the rats into two groups. One group was given wonderful toys to play with in their cage, and they had a nice wheel, and they could be, doing their thing on the wheel, and they could play with all their toys, and they were just, the luckiest rats that you could imagine. And then the other half of the group was in an impoverished cage. They had no toys and nothing to exercise with at all. Well, of course, with rats, you can do something you can't do with humans, which is sad to say that they sacrifice them and then they look carefully at the brain. And all those many years ago, I used to point out that those studies showed very clearly that the neural connections of the lucky rats who were exercising and getting all sorts of stimulation were much richer. And there was a lot more connections, and their brains were healthier, and they were even larger volume, the brain regions, than the rats that were left in a completely sedentary, impoverished condition. So I just found that to be more than suggestive. I thought this is, this is the thing, and we have to push along on this road of proving and showing the importance of exercise. And in fact, I did start to submit applications for studies in exercise, and it wasn't easy to get a thin dime in those early years. Nobody believed in it. And my first grant in that area was from the Michael J. Fox Foundation. And I will be telling you about the study in a moment, about the study that we did that was published now, like 10 to 15 years ago, more than that. Anyway, I'm going to first talk in general about how exercise is important for the general population and general health. And then I'll talk more specifically about Parkinson's disease. So, the more studies that are done, the more we learn about how exercise is beneficial for so many parts of our general health. I mean, there's nobody who can escape this, and it becomes ever more important as we age. Needless to say, many of you already know this, physical exercise has benefit for the heart, for the lungs, for one's blood pressure, for blood glucose, of course, your endurance, your walking speed, your balance, sleep, mood, and even learning and memory. And the fact is that as we grow older, even starting in the 30s and 40s, you start to lose muscle mass. And it's inevitable that your endurance and your strength and all these other things about your mobility are going to suffer without being proactive. So there's also interesting data about physical activity and cognitive decline. The data isn't as robust, but there is enough data to say that there is some impact of being more physically active and cognitively active and socially active on cognition and less risk of cognitive decline. In particular, the studies show that even certain cognitive domains are affected by exercise, and those tend to be memory and verbal fluency. And verbal fluency is something that most people as they age do report as a problem for them. That means finding the words, as you speak. It has also been shown that physical exercise increases the brain volumes of certain regions of the brain. If you compare the brain on an MRI to somebody who is doing regular exercise to somebody who is a couch potato, you can actually measure differences in the volume of certain areas of the brain, certain regions. And in fact, these include regions involved in memory. Most of us are concerned about memory as we age, whether you have Parkinson's or not, so this is important to know. So moderate to vigorous exercise, we'll be talking a lot about moderate exercise versus vigorous exercise, but moderate to vigorous exercise has been associated with improved learning, improved memory, and improved reaction time. Now, if you were listening to me carefully, you heard me say that exercise was associated with certain change in brain volume. And why do we use that phrase associated with? Why don't we just say this doing exercise causes this? Well, it's very difficult to, in fact, show causation. We say associated with because instead we are mostly able with our statistical analyses in most studies to show an important relationship between the intervention and the outcome. However, when you say cause, you are going a big step further and saying that we know without a doubt that this causes this. That's much more difficult because you're never, people aren't lab rats. There's so many different things that are going on in our lives that complicate the issue about how we live our lives. So that's why you oftentimes hear that phrase associated with instead of cause. So how does exercise affect the brain in general? Well, for one thing, we know that when you exercise, it increases the amount of neurotrophic factors in the brain. Neurotrophic factors are what some people have called like a fertilizer to the brain. And there's one particular neurotrophic factor called BDNF, brain-derived neurotrophic factor. That has been shown to be increased in people who exercise, increased in the brain. And what does it do? Well, like fertilizer, it increases the growth of neural connections. And that's what a healthy brain is all about. You want your pathways in the brain to have all these rich connections so that, there's not the atrophy that can occur with simply aging and with certainly with a neurodegenerative disease like Parkinson's. You know, it isn't trivial. When we started to ask the question, and I was one of those people who was doing this study in Parkinson's disease, it wasn't a trivial question. Could exercise improve the brain when in somebody who has a neurodegenerative condition? That's not a trivial question. In other words, there is in Parkinson's disease, there is a process that's causing injury. And is it possible that physical activity can intervene in what is otherwise a degenerative process? And guess what? What we learned the answer is, without a doubt, is yes. It's true that you can intervene in the process with exercise. Another thing that exercise does in terms of affecting the brain is that, especially with the more vigorous you exercise, you increase the blood supply to the brain, which is also extremely beneficial. All of this in terms of the increase in blood supply and those increases in the neural connections and the growth of the nerve cells comes down to increasing and improving what we call neuroplasticity, one of my favorite words. Neuroplasticity is not a complicated concept. Every single time we do anything, anything that we are doing in our life is a change in our environment, a change in our experience, and it causes changes in the wiring of our brain, actually. It remodels the brain. That's how you can remember things. That's how you can learn to ride a bicycle or use a computer or, play a musical instrument. Anything that you're learning to do or any experience you're having is causing a remodeling of the neural connections. And that is what neuroplasticity is. So it turns out that exercise is a strong stimulus for neuroplasticity, good neuroplasticity. I'm going to tell you very briefly about what is a very interesting and even provocative study, again done in rodents. This was in mice. You're going to think that this is like magic, but this was published. In this study, the investigators had a group, kind of like before, of very active old mice. They had old mice, and one group was very active. And they had another group of old mice that was completely sedentary. Well, again, believe it or not, they took the plasma. Plasma is the fluid portion of your blood. They took the plasma from the active aged mice and transfused it into the sedentary aged mice, and were able to show that the sedentary group then showed increased nerve growth in their brain. It's an unbelievable thing. And not only that, they were able to show that the nerve growth was in a part of the brain involved in memory, and on memory tests, the sedentary group improved their performance. I mean, honestly, it sounds like a magic trick, but it does show that when we exercise, there is a pervasive effect on the body, on all parts of the body, that is of benefit to us. So I bet you're wondering, how much do you need to exercise? The age-old question. And I'm just going to start off by saying that any exercise is better than none. And, the idea that there is some magic threshold and that if you don't reach that threshold, you're totally guilty of not doing the right thing. I mean, really, toss that out. It's ridiculous. Instead, we're all individuals. We all have different thresholds of what we can do and how much endurance we have and how much strength we have. And what you really want to think about is pushing the envelope for yourself as an individual. That's what's most important. It turns out that, and I'll talk about this more when I talk about in a few moments, the study that we did, the Fox-funded study, but a combination of different types of exercise is really what you're looking for. And you'd like to have a combination of moderate exercise, vigorous exercise, and muscle strengthening exercise. And studies show that when you combine these different types of exercise, this is associated with increased life expectancy. Now, many people are, quote things like 10,000 steps a day and other kinds of things like that. And really, I mean, it is not any rule that needs to be of great concern. 10,000 steps a day is a lot of steps. I'm sure some of you have done it, and it is a lot of steps. And one doesn't need to be concerned that they have to reach that. As a matter of fact, in a couple studies I read, about 4,000 steps per day was shown to reduce what they call all-cause mortality, meaning death from any cause. About 4,000 steps per day. Now, more is better, they found, so that if you can increase it somewhat, that is of benefit too, even more reduction in all-cause mortality. Turns out the number of steps is more important than the walking intensity. So that's something to keep in mind. And another thing that's been found that's quite interesting is that, some of us, not all of us can do vigorous exercise, and I understand that. But what's been shown is that even short spurts of vigorous activity daily, I mean 1 to 2 minutes, is associated with lower mortality. So you could do a moderate exercise, but if you will insert a spurt of 1 to 2 minutes, an example might be that you say you're going to, although it might be quite difficult, that you're going to walk up the stairs once a day. And I'm talking for somebody who has some difficulty with their walking, for example. But would be a spurt. Or if you are on a treadmill and you normally go at, let's just say, 2.5 miles per hour, on the treadmill. But if you say, oh, I'm going to increase it to 2.7 or 2.8 for 2 minutes, just for 2 minutes, that would be a spurt, and it has more benefit than one might think. But a spurt is not like walking upstairs, is not a substitute for an exercise routine. I mean, one of the things we all have to strive for, all of us, is to have an exercise routine. So what are the recommendations? The recommendations are to do, for moderate exercise, 150 minutes per week, which is 30 minutes, 5 days a week, for example, of moderate exercise. And moderate exercise would generally mean getting your heart rate up to about 90 to 100 beats per minute. This is not vigorous exercise. If you're doing vigorous exercise, this involves getting your heart rate up to 110 to 120 beats per minute. And then the recommendation is lower in terms of the number of minutes. It's actually half, 75 minutes per week of vigorous exercise. Now, having said that, what's most important here is your own baseline. And what's moderate for one person is not moderate for another. What's vigorous for one person is not vigorous for another. If somebody's pretty much out of shape, then doing something relatively modest could be vigorous exercise. It could get their heart rate up to 110 to 120 beats per minute because they're out of shape, basically. So this is a very individualized prescription, basically. Okay, now we're going to turn to Parkinson's disease. But before I do, I just want to say this is a very important note. And of course, you always have to confirm that it is safe for you to exercise with your primary care physician. And this is going to be especially important in people with, with heart disease, with pulmonary disease, breathing problems, with blood pressure instability. Some people's blood pressure drops when they stand up. That could certainly be a factor in the safety of exercise. Imbalance, you have to choose exercise that's going to keep you safe. Okay, so I keep on alluding to the study that we did at the University of Maryland. So what we did with our Parkinson's disease patients is that we divided them into 3 groups. 2 of the groups did treadmill exercise, and 1 of the groups did muscle strengthening exercise known as resistance exercise. The treadmill groups were divided into half of them did higher intensity treadmill, and the other half did lower intensity treadmill, kind of like that vigorous and moderate exercise that we just talked about a moment ago. We divided the groups again into a moderate treadmill exercise, vigorous treadmill exercise, and a resistance exercise group. And these people did supervised exercise 3 times a week for 3 months. The sessions on the treadmill or doing the resistance exercise, the strengthening with weights, was between like 30 to 45 minutes. They worked their way up. And, whenever you do a study, the scientific method is that you start with a hypothesis. So what do you think was our hypothesis about our 3 groups? You're right. We hypothesized that the vigorous exercise on the treadmill would be the most effective. And we had various outcome measures, but one of the main ones were, how your gait speed, and another was how long you could walk in 6 minutes, endurance, and another was your muscle strength. So we were looking at all those things. So, the bottom line, to give you the punchline, our hypothesis was incorrect. In our study, the moderate exercise group did the best. The other 2 groups, all the groups had benefits. But in terms of the overall picture, the moderate exercise group did the best. And I'll talk about why that is, because it led to a controversy in the field of exercise researchers in Parkinson's disease. So essentially what happened was the people who were on the treadmill, they improved in terms of their endurance and their gait speed, but not in their muscle strength. And I had read that in exercise textbooks, and I'd never believed it. It always seemed so counterintuitive that you could spend 3 months on a treadmill and then your legs aren't stronger. It's true. It's true. You do not improve your muscle strength. But muscle strengthening exercises sure do improve your muscle strength, but not your endurance. So it's kind of like a proof of principle that you need to do this combination of aerobic exercise with the muscle strengthening exercise, as well as I always remind my patients to also do stretching. We didn't study that, but stretching is very important, especially in Parkinson's disease, because you tend to move less spontaneously. You spontaneously move less. And therefore, there's a tendency to develop things like a frozen shoulder or strained muscles because you just aren't moving as much and you don't go through range of motion as much. So the controversy is very interesting. And it actually, controversy, and when 2 different investigators, researchers get different results, it's actually very good for the field because it stimulates a lot of chatter and people, line up, I believe in this, and there must be something wrong with your study. But that's all good because it leads to a lot of literature and talk. So it turns out there were 2 other very good, well-respected researchers in the country. And in their study, they showed that the higher intensity, the vigorous exercise, was more effective than the lower intensity, the opposite of what our study had shown. But it's always the devil's in the details. And when I did a careful, everybody was out there and screaming from the rafters, no, it's higher intensity, it's lower intensity. But if you drill down into the details, what turned out was that in our study, the average patient in our study had more advanced Parkinson's disease. And the average patient in their studies had earlier Parkinson's disease. So therefore, the more vigorous exercise was difficult for our patients. They really were not doing a good treadmill workout when the treadmill was being amped up to these high levels. Instead, they were flailing about. They couldn't really keep up with it because they were more advanced and they had more difficult symptoms. So there was this big difference. And I think the point of it is that, again, I mentioned this before, it's an individual thing. It depends on you and your own capacity. And that's what I think this controversy ended up showing. So how hard you exercise, to reiterate, how hard you exercise will depend on your baseline fitness level. Another thing that a colleague did in a very interesting study and it showed the following. That is that what I'm going to call mindful exercise is more beneficial than distraction. And what I mean by that, and I do exercise because partly because that would be embarrassing because I talk about this, but also I really believe in it. And I am guilty as charged. I don't enjoy the exercise that much, so I listen to music. The music is very helpful. And I'm using distraction. It's not mindful exercise that I'm doing. Instead, I'm distracting myself. And I see some people who are on the treadmill and they're watching a TV show or a sports event and I'm listening to my music. And that gets me through and my heart rate certainly goes up. And actually I exercise harder when I'm listening to the music I like because I'm going along with the beat. But it isn't mindful exercise. What is mindful exercise? In the study that I'm thinking of, which actually was done by a group with great expertise in Israel, they had a virtual, the people were on a treadmill and they had either goggles or they were looking at a screen and they saw virtual rocks on the path. They were on a path and they saw virtual rocks and barriers and they had to attend to that and step over things. They didn't step over things, an alarm went off, they made a mistake, they'd goofed. And that group found that the group that was doing the mindful exercise had much better outcomes than the group that was distracting themselves. So, I'm guilty as charged. I'm doing the distraction. But it turns out that mindful exercise, which would mean some sort of program where you're mindfully paying attention to how you're doing the activity, is even more beneficial. So I just have a few more points before I wrap up. In Parkinson's disease, what symptoms improve with exercise? Well, I talked a little bit about that already, but we know that there's a tendency to it's a tendency to generalize when people say, oh, this new medicine came out or this new surgical procedure or exercise, and generalize and say this is good for Parkinson's disease, and then people think it's good for everything. And that's not only good for all symptoms, but people tend to just jump to the conclusion that it may even delay the progression or slow the disease or whatever. We see this all the time. That instead of looking at the details are what really improved. So what symptoms improve with exercise? Well, not everything's going to improve. However, we do know that overall, the range of motion, meaning your ability, how limber you are, as I mentioned, if you're doing muscle strengthening, your strength. Of course, you have to be exercising, doing muscle strengthening exercise for the arms if you want to increase arm strength. For the legs, muscle strengthening to improve leg strength. Doing leg exercises does not improve your arm strength. But, you'd be surprised. Some people don't get that. You do have to do this in a focused manner. The treadmill exercise, all types of aerobic exercise, treadmill isn't a magic pill. It's just easy to find that. It could be a stationary bicycle. You could be walking outside, but you do have to, break a sweat when you're exercising. You're not out, walking in the park. Instead, you have to really exercise. And in that case, you're going to improve your endurance. Improving your endurance is a big deal. It means everything becomes easier when you're not huffing and puffing. So, does exercise delay progression of Parkinson's disease? Does it fundamentally change the actual biology of the disease? That is a very hard question to answer because we are not rats and we're not able to look at people's brains like we can under a microscope with a rat. However, based on animal models, we tend to believe that that is the case, but it's a hypothesis, really. What we can say is that in people, what we know is we can delay the progression of disability. That we know. That people who do a combination of exercises, as we have talked about, are going to maintain their ability to walk, their overall mobility for a longer period of time. And that's a very big deal. There are two things in our studies at the University of Maryland that cause the greatest disability in Parkinson's disease. And number one, is walking. When we lose the ability to walk, it has a very pervasive effect on what we can do overall. The second one is memory. Those are the two things in Parkinson's disease that are the most disabling. Now, people tend to think about a whole host of symptoms that are not unimportant, but aren't as disabling. Tremor is not as disabling. There's a whole bunch of things that we can talk about in terms of symptoms of Parkinson's disease that can be extremely difficult to live with and to manage. But the two most important, walking and cognition. And in this case, exercise can be good for both of them. Does exercise actually delay the onset of Parkinson's disease? Well, there are some studies that have suggested that, but I think it's really too early to say. If as I said, being an exerciser delays the onset of trouble with walking and these other symptoms, then it just may be that people, that even though they're developing Parkinson's disease, they don't come in as quickly because they're able to manage their life quite well. So this is one of my favorite topics. I'm very, very, very interested in it. I find in my practice that there are two camps. There are some people who really embrace this and they take it on in a serious manner. And then there are some people that I think I could talk until the cows come home, and they would not exercise. And so people do divide out that way. Occasionally there are some people who, strangely enough, take it too seriously. It's hard to imagine, but we occasionally see patients who take it so seriously that they're exercising like more than you could imagine. And there is an optimum amount. It's not like you can go absolutely haywire with exercising and you're going to get more and more and more benefit. That has not been shown. And people have looked at that to some extent. I mean, at some point it's exhausting and that it starts to move in the opposite direction. So with that, I'm looking forward to hearing your questions. And I hope that it's been helpful to you.
Okay, so everybody, feel free to ask a question in a chat as we go along. But many of you have pre-submitted questions, and I'll start asking Dr. Shulman now. The first one is, when I feel stiff, usually in the mornings, should I exercise my way out of it or wait until I feel, excuse me, more mobile to exercise?
An interesting question. I think that it generally makes sense to be exercising when you have a good benefit from your medications and you're feeling well and you can move better, because you're going to be able to put in a greater effort when you are, and it'll be safer when you have your medicine on board. So I think that you don't have to have Parkinson's disease to feel stiff when you wake up in the morning. Many people, as they age, feel stiff when they first wake up in the morning. So I would say that the answer to that question is, overall, it's good to have taken your medicine and then do your exercises. Yes.
Do you push through it if you have pain?
Well, it depends on the kind of pain we're talking about, of course, but you know, sometimes exercise can be associated with some discomfort, some muscle discomfort. Goodness knows everybody's heard the phrase that, you feel the burn. Your muscles can feel like they're burning because you're putting in extra effort. And that is good. That's good. Because it shows that you are pushing the envelope, as I said. On the other hand, it's a whole nother story when, as we've all had the experience of pulling something in our back or something of that nature, where suddenly you have a sudden pain and maybe a muscle spasm. That would be a different story. But frequently, one will have some discomfort during exercise, and you can work through it.
You might have kind of answered this one, but how often and what kind of exercise is best for Parkinson's?
Well, I did answer it, but I will reiterate and say that the best exercise to do is a combination of aerobic exercise. Aerobic exercise is where you get your heart rate up to the levels I talked about, and muscle strengthening exercise. And I like to throw in there stretching, because that's going to improve the safety overall, that you're keeping limber. And as far as the amount should be a minimum of 3 times a week. But 4 or 5 times a week would also be good. A common thing is when I ask my patients if they're exercising, a very common thing is that a lot of people say yes. And then when I follow up and say, what are you doing? Some people say things like, I walk my dog, or I take care of my grandchildren. These are very common responses. And guess what I say to them? That is not exercise. That's activity, but it's not exercise. Exercise means that you are doing a certain activity for an extended period of time to get your heart rate up, or to strengthen your muscles. You're doing repetitions. And then after doing repetitions with on a machine or with your weights, then you are going to, in the future, try to increase the weight or the repetitions. That is a progressive program of pushing the envelope and increasing your capacity, which of course is not the definition of walking the dog.
One of the questions that was just asked on the chat was, you haven't mentioned rock steady boxing. How effective do you think that is? And what do you think of that as an exercise for Parkinson's?
I think over the years, I and my colleagues have been very impressed with rock steady boxing. And part of it gets back to the issue about the best exercise is what you do, and so rock steady boxing has found a formula that many people find appealing and fun. It's a group activity, so it's fulfilling both the physical activity and the social activity. And I didn't talk about that much, but studies also show that actual social interaction is extremely important for a healthy mind, a healthy brain. So it ticks a lot of boxes, rock steady boxing, because they have exercise, and from what I've learned from my patients, they are very creative about what they offer. And that's a good thing because it's not boring when it's more creative, and when a trainer, of course, can always be helpful from the standpoint of giving one encouragement. I think from what I can see also, they are extremely resourceful about suiting their program to people at different levels. I've seen, I'm sure that all of you are even more aware than I am, but, I see patients come in, some of whom are in extremely good shape and are enjoying rock steady boxing. And I have other people who, when they say they're enjoying rock steady boxing, I was somewhat surprised that they could do the program, but obviously the program is being, modified for the individual. So, and I have patients who have been doing rock steady boxing now for many years and continue to enjoy it tremendously. Look forward to it. It's tremendous.
Okay, this is a good question. Do you have any idea on how to motivate my husband with PD to do exercise?
Um, I mean, I it's a hard question because one would think logically that hearing about the data would get somebody off their chair or couch and say, well, wow, I mean, listen, there is no doubt, and I tell my patients this all the time, that if you exercise, you are going to not require a cane or a walker as early as somebody who is not exercising. This is true. And that should, for most people, is a pretty big, motivator. I mean, it just simply is true that it's going to make the difference. And the difference is not by a couple of days or weeks. Those of us who are Parkinsonologists and watch our patients over years and years, we see with our own eyes the difference between the exercising patient and the not exercising patient and how they look after 5 or 10 or 15 years of Parkinson's disease. It's as plain as the nose in your face. It's obvious.
You've sort of answered this one, but can you exercise too much with Parkinson's disease?
Yes, so it would be an extreme, but there could potentially be an extreme where you're no longer getting additional benefit, but you are exhausting oneself. as many people know, fatigue can be a symptom of Parkinson's disease. I have had the experience of having patients come in and complain of fatigue. And then when I ask about their daily routine, I've seen one or two patients who were one of these extreme exercisers. And when they started to describe their day and how many miles they were running or walking and doing this and doing that, I thought, well, it would be superhuman to not be fatigued. Anybody would be fatigued. So there does have to be a balance. Some people have a problem with weight loss. I mean, that's another issue, because if you're doing extremes of exercise, you might lose even more weight, burning off all those calories. So it's an individual situation, but yes, it is possible to exercise too much. But having said that, I think that that's an extreme. I have many people who exercise nearly every day of the week. Virtually every day of the week, they're doing exercise, and it's doing them a whole lot of good.
Are there differences between men and women regarding the benefits of exercise?
Hmm. I mean, I don't think that's been studied much, but I think that if you approach it from the perspective that I presented, which is that everyone has to think about their own fitness level, their own strength, their own endurance, their own flexibility. I think that whether you're a man or a woman, it will work for you. You just have to understand more about yourself. Now, some people who are very, have never exercised and maybe are in particularly deconditioned, are particularly deconditioned, you might consider wanting to start with physical therapy or with a trainer to help get you started, so that you start to get a feel for what is your level of conditioning, and then you can build from there.
Does strenuous exercise like high intensity interval training benefit people with Parkinson's?
Yes.
Okay.
It is not, although every study, including our own, obviously you have to settle upon some sort of a study design and a paradigm that you're going to study, but that is not the be all and end all. Instead, in our study, we showed that aerobic exercise was helpful. Well, any type of aerobic exercise that's safe can do that. So, any way that one would design it, that's why you can do it in a more individualized, flexible way. And that could be a very good thing for you personally. You don't have to mimic the study. You instead want to mimic the mechanism of the intervention, which is actually aerobic exercise, increasing heart rate and endurance, and muscle strengthening. Those are the things. And whatever you use to get to that point, that's good.
Are walking poles helpful?
Yeah, well, walking poles can be very helpful. I mean, it is true to keep in mind that, for example, I've read that if you're on a treadmill, if you walk on it on a treadmill and you don't hold on to the bars, the side rails or the front rail, apparently you burn more calories than when you hold on. But many of us don't feel comfortable on the treadmill without holding on. And from that standpoint, it's more important to feel safe and be safe and to feel secure than it is, to do the perfection. Yes, I mean, I think you'd put walking sticks in that kind of a category, that if that is what makes you feel like you can go further and go on certain kinds of terrain that otherwise you wouldn't feel secure, all the better.
Is one session of exercise per day sufficient, or is it better to have 2 to 3 movement periods per day?
I haven't seen that studied. I don't know if there is a specific benefit to a longer session versus a couple of shorter sessions. So I don't have a good answer for that.
And the last one I've got is, and I think you've answered this too, but what is an optimum exercise schedule just for 1 week? Well, I don't mean just for 1 week, but for a week.
Right. I mean, I think that you should set a goal of no less than exercising 3 times a week. That isn't necessarily the ideal, but that's the minimum. 3 times a week. And that the session should be, be good to spend about at least 30 minutes on that treadmill or stationary bike. But you have to work up to that. So you're not going to start that way. You might start at 10 minutes or 15 minutes and gradually work your way up. And then you're going to do some of your stretching and you're going to do some of your weights. And that's going to end up probably being about an hour of exercise in total. So a minimum would be about all of those modalities for about an hour, 3 times a week. But if you can do 4 or 5 times a week, that would have additional benefit.
Okay, that was the last question that I had, and I don't see any other questions in the chat. Does anybody have any other questions? Now's the time. I guess not. I think we got them all answered.
Okay, well, it's been a pleasure to be with you. And Judy, thank you for inviting me and
Oh,
for putting
thank you
this
for
together.
coming. Thank you. Really, I appreciate it. And I know everybody else does too. So thank you.
Okay,
Have a good evening, everybody.
bye-bye.
Thanks. Good night.